Si tu as prévu de travailler en tant que médecin dans un pays francophone, notamment la Suisse, et tu cherches tes ressources médicales en français pour t'aider à traverser cette période de transition, cette vidéo est pour toi. Welcome back. For those of you who are new here, my name's Sarah, and after graduating from King's in London, I moved to Switzerland where I'm currently training as an internal medicine resident. I make videos about medicine, life as a doctor, and all things Switzerland. When I moved to Switzerland, I couldn't use my UK medical protocols and algorithms anymore. I could immediately see there were differences in management and different medications as well. But then I thought, no worries, I'll just look at the official Swiss guidelines. So I started searching online, and I kept searching. And I realized that Switzerland doesn't have national guidelines. There isn't a centralized set of guidelines like the NICE guidelines we have in the UK. Suffice to say, I felt a bit lost. Over the years, I've collated a list of resources that I found by informally interviewing every Swiss doctor I came across, hunting for every local protocol I could get my hands on, just so you don't have to. So if you're wondering what guidelines Swiss doctors use, you're in the right place. So without further ado, here's a non-exhaustive list of resources, including apps and websites, that my colleagues and I use pretty much on a daily basis. Insert some sort of disclaimer here saying that there might be errors on these web pages and they're not official guidelines. So in no particular order, let's get started. The only section I've sort of grouped together is for antibiotics. For antibiotics, in the French-speaking side of Switzerland, everyone uses the same thing. It's the Guide d'antibiothérapie du CHUV, which is basically the antibiotics guide provided by Lausanne's University Hospital. Let me show you what that looks like. So if you just Google CHUV Guide antibiothérapie or something along those lines, you can just click on their website and there's a link. You'll see it's 2022 because there's been an update. But let's just go to what people are still using. So essentially what it is a booklet. So we've got printed out versions, but it's exactly the same thing online. And if you go to the contents page, you'll see all types of infections. So if you go to sepsis, so there's the definition, the recommendation, a few key points that you need to think about, and then the different antibiotics depending on the context. So this is pretty much what we've been using for the last couple of years. And now there's been an upgrade. Switzerland is slowly moving forward and they've made this app. So this is the next resource. And from now, essentially, we're being told to use this app as the updated version of the Lausanne antibiotic guide. So essentially, it's the same as the PDF. If I zoom in here, you can see that there's different hospitals, so you just pick the one you're working at. If you're not in Switzerland, just pick any, it doesn't matter. And then you can see here, depending on the different systems, so there's sepsis, there's respiratory system, central nervous system, etc. And it's pretty good. So I started using it and it's pretty detailed, it's well organized, it's well structured, and once you get used to it, it's better than sifting through a PDF. So first line is now what we use in Switzerland for antibiotics. So this is something I came across when I was just looking on the internet for different Swiss resources, and it does look like pretty official Swiss guidelines for antibiotics. I did a bit of a comparison with first line and the PDF guide from Lausanne and this website for antibiotic choices, depending on the types of infections, and they're pretty much similar across the board. So this is something that you can add to your repertoire. And if you click on this one, so this is Directive Nationale, you can change the language in the bottom left. So I'll just leave it in French. And then you look in the contents page. Let's say you go to abdominal, gastroentérite infectieuse, and then you've got definition, symptomatic treatment, antibiotic choice. So this is a pretty good resource as well. Honestly, I don't use it that much just because now we've got first line and I just got used to using the PDF as well. But it's definitely another resource you can use for antibiotics. So now we're done with the antibiotics section. Let's move on to the rest. The next one I'm going to talk about is Reco Médical. So Reco Médical was actually recommended to me by a GP in France, and it's actually a really great resource. I think it's really useful if you're starting off in the French language because it's a very well-structured presentation of many, many different conditions. And so, for example, let's just put pneumonie. And here you've got a very brief summary, got résumé, so a summary of what you need to know. And then you've got for adults, kids, and depending on like what you want to see, the clinical presentation, how to prevent pneumonia, how you manage it, and the different sort of protocols. The next one I want to talk about is a real jewel. I still use it to this day. It's honestly fantastic. And it's called Stratégie de médecine de premier recours. It's made by the Geneva University Hospital, so HUG. So essentially, it's a website format of a very well-structured approach to médecine de premier recours, which is essentially ambulatory care. So this could be used in a GP practice. It could be used in ED. Where I started using it is when I was doing my ED rotation in the ambulatory side. So where you have a lot of trauma, so fractures of all sorts, where you can have coughs and colds and upper respiratory problems and just a bunch of things that aren't very serious, but if you're not used to dealing with them, if you've only worked in a hospital, this is a great structured and very simple to read through approach. So let me show you what that looks like. So I just Google it every time, stratégie de médecine de premier recours, and if you go down here, you'll see it's structured by different body systems. So cardiovasculaire, gastrointestinal, and let's go to one that so I'll just show you what they look like. And then one that I use very often is traumatologie, and they go through pretty much everything. Protocole de traumatologie ambulatoire, and you click on voir les protocoles. And here you've got every trauma you can think of, and it's honestly fantastic. Let me just give you an example. So cheville. So if you've got a patient presenting with trauma of the ankle and you've got this, you're good to go. This is essentially a summary of when you need to do an x-ray, of how to do your clinical examination, a reminder of the anatomy, of radiological signs, when to follow up and how to follow up, the common types of fractures, how to manage them with different kinds of casts, etc. I mean, I keep saying it, but it's just fantastic. I use this, all my colleagues use this. It's very, very well made. And if I show you another example, so let's say very common things. If we go to pneumologie, so infection des voies respiratoires supérieures. So this is for any upper respiratory symptom. And sometimes it can be, a bit tricky to categorize and know when to give antibiotics, when to do X, Y, Z. And this just helps you go through it in a very logical and safe way. And so you've got how to diagnose, how to treat. So this is relatively specific to Switzerland, but it's different medications you can give. And it's very detailed, but also well structured, so you can quickly find the information. I just love this website. Honestly, if there's one that I would keep from all of them, well, I'd have to keep first line for the antibiotics, but this would be the second one. So I'll let you explore this in your own time. But yeah, it's amazing. The next one we're going to talk about is called Revue Médicale Suisse, and it's a Swiss journal that's online. You can pay for it, so you can get the paper format, and I believe there's an app as well, but I've never used it. This is another one of those unofficial guidelines that everybody uses. Some of the articles are really useful. So let's say for one I go back to often is paracetamol overdose, Revmed. So intoxication aiguë au paracétamol. And I mean, it's pretty much what you expect of any journal. So there's different articles. I'd say most of them are very high value. So this one about paracetamol overdose, they give you a bit of a brief introduction, pathophysiology, how to categorize it and stage it in terms of risk assessment, different investigations you want to do, how to measure the probability of toxicity or not, the treatment protocols. And because it's a Swiss journal, it's more adapted compared to some other journals I might have from the UK. Like all the other things I'm showing you here, it's not 100%, it's not an official guideline. It's more something to add to your repertoire that can sometimes be very useful, but other times you'll find better resources. I feel like I'm not selling it well enough, but I definitely use it on a weekly basis, let's say. Whereas médecine de premier recours, if I'm in ED, I use on a daily basis, pretty much. Next one we're going to talk about is Up to Date. You probably know about Up to Date. It's not a Swiss resource. I believe it's American. And it does what's written on the tin. So evidence-based clinical solutions for healthcare. That's what it does. I remember when I started off in Switzerland, I would ask all my SHOs what they used for protocols and guidelines because I was a bit lost. And they all pretty much use Up to Date. The way in which it's different to the other ones I've mentioned so far is it's much more detailed. It's well structured. I don't know if I'm going to be able to show you an example because it's subscription based. Let's look at the treatment of hyponatremia. So as you can see, it's very dense, very, very dense, which also means that if you're slightly more advanced, it'll probably give you the answer you're looking for, whereas you might not find it in the other resources I've provided. But the good thing is it's very well structured. So you can easily find a quick piece of information, even if you see all this dense material. So let's say you just want to know about the severe symptoms. Well, I can't show you because it's blocked right now. By the way, you can also always change the language. And if you're thinking of moving to Switzerland and you want to start reading things in French, I also recommend going to any of these resources and just changing the language to French so that you can start getting used to reading medical terms in French. So for me, Up to Date, again, is something I use alongside all the other things I've mentioned. And for certain cases, I find it's very useful and better quality than others. So for example, for the cause of hyponatremia, I really like this diagram out of all the ones I've seen so far. I just think it's very practical, very clinical focused. diagnosed, which is always, I think, a good idea. And so, for example, here you've got low sodium. Is there presence of hypoglycemia or not? Do you suspect pseudohyponatremia? Then you measure the osmolality. You look at the volemia of the patient. You look at their medication, etc., etc. But yeah, so this is a very good resource, much more detailed than the others. Everyone in internal medicine uses them, so that gives you a bit of an idea. So it's very well loved in Switzerland. The next one I used when I started off in Switzerland and I found very helpful. I don't use it at all anymore, but I do think it's worth a mention because it was helpful at the time and it's the bread and butter of every single medical student here. When I arrived, I saw this pink book lying around everywhere and I thought, what is this book and is it really that good? And what my colleagues told me is they all used it for their medical school exams and in their first year or two of residency. Like I said, I don't use it now and I see fewer and fewer people use it, but I think it's also because I'm progressing in my training and so it's not really hitting the spot anymore and I'm using other things like UpToDate instead. So let me show you what it looks like. The good thing is there's the book version, which is really hard to find, and then there's the app. It's subscription based as well. I paid the subscription for a year and I didn't renew it afterwards, so just to give you an idea of how long I used it. But it's this book. I believe the newer version is the green one. And if you look at the app, I don't know if they'll let us look at an example of a page. Aller à l'application web. So yeah, there's an example. So if you look at, well, let's look at tachycardia. So tachycardie, okay, that'd be really stingy. We've only got access to a few ones. And so here, this is what the book looks like. You've got a brief explanation, general points you need to know, what the ECG looks like for dorsal de pointe, how to classify it, the treatment. So it's pretty aesthetic, I would say. It's nice to read, easy to read, and it's a good start. So I would recommend it. I don't think it's indispensable. If you like apps and you like well-structured resources, then this is a good one to start with. Another one I want to mention is not something I use day to day, but it's a really nice resource and I think we should have more of them. And it's a campaign called Smarter Medicine and it's run by the Swiss Society for General Internal Medicine. Let me show you what it looks like. Their aim is to improve the quality of healthcare in Switzerland by trying to improve our everyday practice and do things based on evidence rather than, oh, that's how I was taught or that's how I've always done things. Let me show you an example. So if we go here and down to internal general medicine. So here's a quick example. You've got some key points. So this is really the thing that you'll take on to your everyday practice. And then an explanation as to why they recommend this. So here, don't order extensive blood or x-ray tests at regular intervals without a clinically specific question. It might seem obvious for most of us, but when you're starting off and, you're paranoid of every possible thing that could go wrong, you might have a very generous hand on the ordering bloods button. And this is a good reminder as to why, from an evidence-based perspective, it doesn't actually improve the quality of care that you'll give your patient. Another example would be don't administer benzodiazepines or other sedatives for insomnia, agitation, or delirium to older people as a first choice, and avoid prescribing such medications at hospital discharge. This is something I see quite often where people will get a certain medication in the hospital and we either forget to remove it on discharge or we sort of leave it but don't have a solid long-term follow-up plan. And all these things can have a massive impact on our patients. And it's the little things. It's the little things that we can change in our practice every single day if we just pay a little bit of attention to them. So although I don't use this website often, I'm a big fan of it and I think it's definitely something that enriches our day-to-day practice and the quality of the care that we provide. I think we're going to stop here. I have a lot of other resources that I could mention, but I don't want these jewels to get lost in a crowd of jewels, so we'll leave that for another time. Regardless, whether you're a doctor who's already working in a French-speaking country or you're planning on doing so, these are all excellent resources that my colleagues and I use every day in Switzerland, so I really hope you find these useful. If you enjoyed this video and you're hungry for more resources, let me know in the comments down below. I hope you have a great day and I will see you in the next video. Bye!